There are mainly 3 different types of medications for psychotic behaviors. There are atypical antipsychotic medications, typical antipsychotic medications, and Antiparkinsonian and Anticholinergic medications. Expert guidelines recommend starting with the atypical antipsychotics first. Risperidol is the treatment of choice for a first episode psychotic patient with positive symptoms, negative symptoms, or a combination of both. Abilify, Zyprexa, and Zyprazidone, and as well as Seroquel, are additional choices but are secondary to Risperidol. Invega has been shown to be as effective as risperidone, but it has the same dose-related extrapyramidal symptoms. Its primary elimination through the kidneys may make it a drug of choice for patients demonstrating liver abnormalities. Clozapine was rated an excellent choice for second-line treatment after adequate trials of at least 2 of the atypical agents. For multi-episode psychotic patients, risperidone was again the treatment of choice. In addition, Risperidol Consta, the only long-acting atypical antipsychotic, is considered an excellent second-line choice. Over the last decade, atypical long-acting injectable medications are growing in importance to address issues of non-adherence and ease of dosing. The atypical antipsychotics have little or no EPS. Risperidol shows a clear dose-related increase in EPS and prolactin level, especially at doses greater than 6 milligrams daily. Prolactin is a hormone secreted by the pituitary gland that increases when dopamine is blocked or suppressed. Increased prolactin concentrations may lead to breast enlargement, galactorrhea, irregular menses, and so on. Patients who receive increasing doses of Zyprexa likely exhibit akathisia, Parkinsonism, modest prolactin elevation, and weight gain. Using Abilify as an adjunctive therapy with Zyprexa may mitigate weight gain and adverse effects on lipid metabolism. Saffris is less likely to cause weight gain and prolactin elevation. Zyprazidone shows a trend toward an increasing level of anticholinergic effects at higher doses, but it may be less likely to elevate prolactin levels or cause weight gain. Seroquel, although still likely to cause weight gain, may be an alternative for patients who must switch medications due to serious weight gain and cholesterol levels. Seroquel has been found helpful as a sedating agent, but because it has developed a reputation as a drug of abuse, some have reconsidered using it with those who have a history of substance abuse. Latuda is one of the new antipsychotics that is associated with minimal effects on body weight and low risk for alterations in glucose, lipids, or EKG parameters. However, there is a potential for drug-to-drug interactions, as it is a strong inhibitor or inducer of certain liver enzymes. Rexulti and Vraylar are partial dopamine agonists with fewer side effects. They may cause more weight gain and increased appetite. Rexulti may cause more weight gain and increased appetite, whereas Vraylar may be associated with more EPS. Clozapine results in the most weight gain and sedation of all agents. Abilify MySite is a drug-device combination product made of Abilify tablets embedded with an ingestible event marker sensor intended to track drug ingestion. This digital medicine device allows objective measurement of adherence and potentially improves rates of adherence in patients with schizophrenia. Nuplazid is a new atypical antipsychotic for the treatment of hallucinations and delusions associated with Parkinson's disease psychosis. Now we get into typical antipsychotic medications. The typical medications may worsen negative symptoms because of their side effect profile. Extrapyramidal symptoms have a tremendous negative impact on treatment. Acute dystonic reactions are uncomfortable, frightening, and lead to poor compliance. Bradykinesia, cogwheel rigidity, and stiffness, which are all Parkinsonian side effects, contribute to the negative symptoms of the illness. Akathisia is a common subacute side effect related to these medications and may be experienced as restlessness, anxiety, agitation, or insomnia. Tardive dyskinesia is a major chronic extrapyramidal symptom that should be avoided if at all possible. The typical agents also have a negative impact on cognition, which further impairs the patient's ability to think and function independently. All of these side effects contribute to discontinuing therapy and long-term compliance issues. Typical antipsychotics vary with their ability to cause side effects, including sedation, autonomic effects, and EPS. Autonomic side effects refer to the adverse effect of medications on the autonomic nervous system and include dizziness, hypotension, and flushing. The typical or conventional antipsychotics are known for their EPS effects, which include acute dystonia, Parkinsonism, akathisia, and tardive dyskinesia. An acute dystonic reaction may occur immediately following a dose of medication and involves intermediate and sustained spasms of the muscles of the trunk, head, or neck. Dystonias usually occur within hours to days of the medication and typically are very frightening to the patient. Parkinsonism, the second form of EPS, may include rigidity, bradykinesia, shuffling gait, and tremor. Patients who take dopamine receptor blockers may look like they have idiopathic Parkinson's disease. The most common extrapyramidal side effect is akathisia, which translates to an ability to sit still. It can be characterized as feelings of inner restlessness, inability to keep the legs still, constant shifting of weight from one foot to the other, walking in place, frequent shifting of body positions in the chair, and so on. The last type of EPS is tardive dyskinesia. It is an involuntary movement disorder that may occur after the patient has been on the medication for months to years. Tardive dyskinesia is abnormal movements including lip smacking, sucking or puckering, facial grimacing, blinking, tremors, trunk movements, and so on. Approximately 10 to 20% of patients who are treated with dopamine receptor antagonists for more than a year are at risk for developing tardive dyskinesia. Certain populations, such as elderly females and patients with mood disorders, are at greater risk. Drugs like lithium may offer some protection from tardive dyskinesia. However, experts caution against adding lithium unless a mood stabilizer is clearly needed. Both Austedo and Ingrezza are now approved treatments for tardive dyskinesia. Clozapine is indicated for treatment-refractory schizophrenia. Most clinicians define treatment refractory as failing to respond to one or more conventional antipsychotics and to atypical antipsychotics. In some instances, electroconvulsion therapy may be considered after other options have been exhausted. The primary goals of treatment are rapid and complete control of acute psychotic symptoms, avoidance of functional deterioration, and prevention of relapse.